So, what would happen if you didn't need another consultant or a retired mentor or, say, some expert to come in and help you implement a new program? What would that be like, and how would you do it? Hi, I'm Bruce Spurlock, a physician and healthcare leader committed to helping professionals and decision makers navigate change with clarity. On Viral Healthcare, we examine the ideas that are spreading all across healthcare, what makes them sustainable, and what makes them fail. So today I want to talk a little bit about how we increase your success rate, or maybe a baseball way to think about how do we increase your batting average so that you have much more in the way of successful outcomes with new innovations, new implementations, new protocols, new practices, things that you're trying to organize your company around to be more successful. What would that look like? Well, first of all, I want to look at it from two different angles today. I want to look at it from what is success and how do we determine if something is successful or not. And then I want to talk about this problem that I mentioned on our podcast this past Tuesday about overconfidence. Most senior executives, most decision makers tend to be overconfident. And it's not because we're bad people, it's because we're people. We're wired that way. So let's go back and start with the first question. What's success? You would think this is pretty easy. I mean, if you went and asked a bunch of 100 executives, they would describe it. But you know, the interesting part, they'd probably describe it very differently from what their version of it is. It's success is kind of like intangible in some ways, and yet we need to think about quantifying it and determining it in advance if we're going to be successful with any kind of an intervention, whatever that means. So there's maybe total success. There's success from quantitative, measurable outcomes, or maybe it's perceptions. Maybe what we really care is, did the docs like it, or did the health plans work with it? So that might be do it. Maybe it's spread across the entire country, and that's a measure of success. Whatever it is, we need to think about what is it that we're trying to do. Maybe a measure of success is that we did it on time and on budget. You know, that might be a very good measure of success to do it. But thinking about it in the first place is the first important thing to do when you're talking about a new innovation. There's total success, and to be honest with you, it doesn't happen that often. There's partial success. It's kind of neutral where, yeah, it worked on some things, didn't work on other things. And there are times when a project, a new innovation, new idea just doesn't work very well at all. Maybe it has some initial improvements, but it's not something that's sustainable. And then there are the true disasters. They don't happen very often, but where you have unintended consequences that really make it a failure. So those are different ways to think about success, related to timing, related to outcomes, related to perceptions, related to budget. All of those ideas of what success is really is something that we want to set up right from the beginning. And the real problem is most of us has a very vague definition. I spend a lot of time in quality improvement helping organizations create an aim statement, and it really is much harder than you think because we don't really have good ways of describing it in advance. So that's one of the problems. But the bigger problem is that by and large, most decision makers, most people are overconfident. So why is that? Well, it's because you've got this experience and you've got this intuition and you've done things like this before and you've been successful. Otherwise, you wouldn't be in the decision-making role. And so you rely on that, and it gives you a layer of overconfidence. But I think the real reason that most decision makers, most executives, people, is because to understand, to get your arms around it, you have to simplify. And we tend to oversimplify. I found this out when I'm trying to get started with using AI. I ask a relatively simple question, and it comes back with a super complex response, much more complex than I could ever think about. And when I look at it, I'm going, man, a lot of these are really right. I know them, I'm familiar with them, but my brain initially couldn't think in advance or comprehend them. And so it's sort of our natural process to create pillars or create principles or create goalposts for a project that we're trying to implement, and we try to simplify it from a management standpoint. So we want to get our arms around it and understand it, and we also want to sort of manage it. But that oversimplification tends to give us overconfidence because we think we can get our arms around it very easily. Many of the things we're talking about are complicated, which means they have multiple steps, not just a couple of key principles to be able to implement. And with those multiple steps, maybe thousands of them, hundreds of them for sure in many cases, we try to take off big chunks at once. We have this perception, and I heard this from a speaker one time, people overestimate how much they can accomplish in a year and underestimate what they can accomplish in 5 years. And I think that's so true. It really rewards this persistence rather than thinking that we can take big chunks and big bites and make big goals happen really rapidly. So that's some of the genesis of it. So the question really is how are you gonna avoid oversimplification? How are you gonna get your arms around the complexity before you start, before you actually launch any component of the initiative, and then yet be able to break it up and build it up into something that's you can discuss and share with others, and maybe not necessarily talk about the complexity, talk about the aim, but understand it. Sort of thinking about the JFK moonshot. You know, the moon was an easy goal to talk about. The complexity to get there was phenomenal. It was absolutely incredible. So here's the question for you today. What are you going to do when you're thinking about your next decision and it's something that you think you can do? How will you avoid overconfidence? So if you like this discussion, go ahead and share it with a friend. And if they're going through something where they're trying to navigate change, maybe it'll help them as well. And if you like this series, if you like what we're talking about, join us on Tuesdays where we go into much more depth in our podcast on viral healthcare. It's here on LinkedIn, and you can also get it on your favorite platform. On the next episode, we're going to talk about the personal stuff. We're going to talk about why you might make decisions based on your personal trends, characteristics, personality types, all of those kinds of things. Until then, I'm Bruce Spurlock. Have a great day.